Hi, I'm Alyssa,
I'm Claire.
and we are doing our substance abuse project on hydrocodone.
Hydrocodone is an opioid derivative with the trade name of Vicodin. The street name is Vic. It's used in the medical setting to relieve severe pain when other pain-relieving methods have not been successful. It's commonly abused when a patient receives a prescription for Vicodin and becomes dependent on the substance, leading to an increase in use and addiction.
For the user demographics, patients usually receive Vicodin via prescription when they have severe pain. Another way is when people use illicit drugs and obtain Vic illegally. 99% of hydrocodone abuse takes place in the United States. Patients who are addicted to hydrocodone commonly engage in the practice of doctor shopping to obtain their supply. And according to the Centers for Disease Control and Prevention, over 11.5 million people over the ages of 12 years old have abused prescription opioids.
Hydrocodone can affect the mind in many ways, including changing the brain's response to pain, as well as the central nervous system's response to pain. Hydrocodone can cause euphoria and hallucinations. It's commonly combined with heroin to increase the euphoric effects. Apathy, dysphoria, impaired judgment, attention, and memory may eventually be altered with abuse of hydrocodone.
So symptoms that can occur with hydrocodone use include sedation, constipation, respiratory depression, reduced level of consciousness, addiction, pupillary constriction, slurred speech, psychomotor problems, and there are many other adverse events that can occur as well.
Opioid withdrawal can create potentially life-threatening complications related to a syndrome of symptoms that include nausea, vomiting, muscle aches, diaphoresis, lacrimation, fever, and insomnia. These complications can include cardiac arrhythmias, coma, respiratory depression, and death related to opioid intoxication. When a patient is withdrawing from opioids, they may experience fluid and electrolyte imbalances related to vomiting, diaphoresis, and lacrimation. They can also have difficulties in respiration and decreased level of consciousness.
So some nursing challenges in the ER that can occur include dehydration because of nausea, vomiting, lacrimation, diaphoresis, etc. And fluid electrolyte imbalance may occur as well. Nurses need to be aware of this, assess and get lab reports, and fluids may need to be administered. Because of the arrhythmias, an EKG may need to be obtained. Orders for medication to correct the heart rate may need to be administered quickly as well, and you'll need an order for that. You may also need to administer Narcan to reverse severe respiratory depression related to opioid intoxication. Generally, this intervention is completed when respirations are below 10, usually between 8 and 10, with severe level of consciousness impairment. When administering Narcan, remember this takes away all good feelings, so the patient may wake up extremely agitated and violent.
While there are nursing challenges in OB related to hydrocodone, pregnancy is not a valid reason to not prescribe opioids for pain relief. However, with abuse, babies can be overly sedated while in the womb and after birth. Infants commonly have neonatal abstinence syndrome, NAS, because they are exposed to narcotics in the womb and will thus undergo withdrawal. NAS is a serious and highly variable condition characterized by central nervous system hyperirritability and autonomic nervous system dysfunction. The baby may experience poor intrauterine growth, premature birth, seizures, other birth defects, and many troubling adverse events.
I made a little storybook, and this is titled Harry and the Hard Times with Hydrocodone. Yes, indeed. Illustrations. Harry was playing basketball with two of his friends, Victor and Cody. Victor, Cody, Harry. Indeed. Victor was bad at sports. Victor was down by 20 points. He then charged Harry.
It was not a good situation.
No. His hairs also grew dramatically.
Yes. Harry fell down and he was hurt. See, Harry says ow, Victor says oh no, and the son's crying. It was a traumatic time.
Still get emotional. So Victor takes Harry to the hospital. A doctor examines him and his ACL is torn. It's a very low budget hospital, but they have a decent bed and Dr. Hare with her pink stethoscope.
Yep, indeed we do. Harry had surgery and he was prescribed hydrocodone and sent home. Here he is being wheeled out of the hospital with his pills by the nurse. He thinks it'll help with his pain.
Which makes the son happy.
Yes, indeed.
Several months later, Harry is still taking his pain medications. How do I get more of those pain meds, says Harry, as he's watching TV.
Yeah, he's just kind of living a solitary life. Harry's friends are worried. He used more pain meds than usual lately. They're worried about Harry. Cody and Victor are worried. So is the son.
They convince him to go to Valley Hope. They treat his symptoms there. So this is Valley Hope.
Valley Hope with their little flag and everything. They help him get on the right track again. And eventually he'll play basketball again even.
Mm-hmm.
Yeah, indeed.
The end.
And these are all the references that we have included within the PowerPoint.